In this video, I'm going to walk you through exactly what happens and what you can expect in your first hyperbaric oxygen experience. From the moment that you arrive in our office to getting into the chamber for the first time, your experience during your session, and the depressurization process, we are going to go over exactly what to expect during your first hyperbaric dive. I'm Dr. Jason Saunders, and my goal here is to make you feel as comfortable and as confident as possible for your first session. So should you decide to come in for hyperbaric therapy, before you even have your first session, we would have a consultation to go over your health concerns, your health goals, also anything that may preclude you from participating in hyperbaric. While this treatment is incredibly safe and effective, it is not for everybody. So we want to make sure that hyperbaric is going to be safe and help you reach the goals that you have in mind. Also, during that consultation, we will go over various office policies and procedures. And lastly, we will go over what a potential protocol would look like for someone with similar health concerns or health goals. After the consultation, you'll be invited to make your first appointment for your first actual hyperbaric session. Once that appointment is made, you'll receive an email. And inside that email, it will review a lot of the material that we went over in the consultation. It'll discuss what you should wear, what you shouldn't wear, what you should bring, what you shouldn't bring. It will go over ear equalization and how to manage pressure changes while you're inside the chamber. And it will also confirm the day and time of the appointment that we scheduled. When you come into the office for your first hyperbaric oxygen session, you'll be brought into the hyperbaric treatment room where you will be greeted by one of our hyperbaric technicians. That technician will give you an orientation of the chamber and the equipment that we'll be using. And they will review many of the details that we also talked about during the consultation and that were inside the email that we sent you when we confirmed the appointment. This is really just an additional step to make sure that everybody's on the same page and knows exactly what to expect on their first session. Once you're feeling ready, the technician will help guide you into the hyperbaric chamber, show you how to wear the oxygen mask, and help make sure that you're feeling comfortable inside the chamber. Then as soon as you're feeling ready, the chamber operator will then close the door and begin the pressurization process. The first thing you'll notice is pressure changes in your ears. Very similar to being on an airplane. You can swallow, take a sip of water, yawn, or do what we call a Valsalva, which is the pinch your nose and blow maneuver to equalize the pressure in your ears. You're going to want to do that equalization process early and often. Now, if you're unsure of how to equalize your ears, we did another video on the 3 top ways that people typically equalize their ears inside of a chamber. So if you're wanting that information, check out the video we did on ear equalization. It's important to be equalizing early and often. You don't want to wait for the pressure to build before you really start equalizing. I'd rather you do more equalizations more often. You cannot overdo it, but you can underdo it. The longer you wait, the more difficult it is to equalize. So staying ahead of the pressure is key to staying comfortable during the pressurization process. For some people, equalizing their ears is a relatively new skill, and it's important that we have everybody in the chamber feel relaxed and comfortable. If that pressure is building up and you're starting to become uncomfortable, you just need to communicate that with our technicians at that moment. From the outside of the chamber, we can pause the pressurization process. We can even depressurize you a little bit, helping to facilitate equalization during that pressurization process. You should never have pain inside the chamber, so if you're getting uncomfortable, make sure to clearly communicate that with your technician. When you're running a hyperbaric clinic, this is a long-term relationship. It's so important to develop systems, policies, and procedures that help keep patients comfortable and calm, and so that they have a good experience inside your office and inside your chambers with your technicians. Many patients coming into a clinic for the first time are nervous. And if we don't develop rapport, help keep them calm, make sure that they're safe, and ensure a good experience, they may choose not to go through the entire protocol that they need to get the results that they want. And if you're looking to improve your process, your policies, and your procedures inside your clinic, check out our certification courses where you can learn all of this and a lot more. After about 5 or 6 minutes, that pressurization process will be complete. And while you'll be under pressure at that time, you will no longer feel those changes inside your ears. In other words, while you're at pressure, the full treatment pressure, it doesn't really feel any different inside the chamber than it does outside the chamber. At that point, you can just sit or lie down and just relax and breathe comfortably. During the session, a lot of people read, meditate, or even take a nap. The overwhelming majority of the chamber session is very calm, it's very peaceful, and it's very relaxing. You should be comfortable and just breathing normally. You won't feel yourself absorbing any oxygen. You won't feel the pressure anywhere else on your body. Though, because you're under pressure and breathing pressurized oxygen, you'll be absorbing oxygen at many times the amount that what you and I are getting right now. Typical hyperbaric sessions last between 60 and 90 minutes, depending on whatever protocol we've decided on. And while we say the session is 60 or 90 minutes, we actually mean bottom time. In other words, 60 or 90 minutes at the treatment pressure. So a 60-minute session might be 75 minutes, a handful of minutes to get to pressure, 60 minutes at pressure, and then a few minutes depressurizing once the session is complete. While the chamber is depressurizing, again, you're going to start to feel that same sensation in your ears. Although this time, there's really not much you need to do to equalize. In other words, while the chamber is pressurizing, it's very important that you are manually adjusting to those pressures through the yawning or the Valsalva maneuver. During the depressurization, although you'll feel that same pressure change on your ears, because the air is expanding, it's going to find its way out on its own. All you'll need to do or want to do is either swallow or yawn. In fact, we prefer you not do a Valsalva during that process. Just relax, move your jaw, and allow that pressure to leave your ears on its own passively. While you may choose to meditate or do some breath work during the actual bottom time while you're at pressure, when pressure is changing, either in the beginning of the session during pressurization or at the end of the session during depressurization, it's important to relax and breathe normally during those pressure changes. Once fully depressurized, the technician will then open the door and help escort you out of the chamber, and you will have completed your very first hyperbaric session. The real impact of hyperbaric oxygen is not from any individual session. It's from cumulative exposures of pressurized oxygen over a period of days, weeks, and even in some cases, months. So please understand that whatever your health challenges may be, or whatever your health goals may be, not everything is going to be magically fixed from a single hour inside of a hyperbaric chamber. Most people after their first session feel very relaxed, very calm. Some feel clear-headed or more focused, and other people feel slightly energized. Most people after their first session will also sleep incredibly well on the days where they're diving. In other cases, some people may feel even a little bit tired or a little sluggish. If that's you, please don't worry. It's completely normal. The body will be using this increased amount of oxygen for various purposes. And as a result, the responses that you feel from session to session may be a little bit different. Our aim is for each session to be a relaxing and comfortable experience so that we can move through whatever protocol you need to meet whatever health concerns or health goals you happen to have. Generally speaking, sessions get easier and more comfortable over time. If you were a little nervous on the first session, or if you had trouble equalizing on that first session, equalization only gets easier. The chamber experience only gets more comfortable session by session. So please don't worry if that first session wasn't perfect. I promise that each session you will become more comfortable over time. Office policies and procedures likely vary office to office. I wanted to walk you through what it looks like inside of our clinic when a new patient is coming in for their first session. This new patient experience is also what we teach in the certification courses that we hold as we train and certify other clinics and help them run a safe and effective hyperbaric program. If you're running a clinic and you want more information about that patient journey and or the systems, the policies and procedures that we use and we teach, I encourage you to check out our certification program. Hopefully this video has put some of your concerns at ease and answered a bunch of the questions that may have been running around inside your mind. And we look forward to seeing you and serving you in the near future.